The doctor is in. I'm Dr. Freddie Gomez, and this is Med Talk, Health Talk. Summer season is all about getaways and festivities. Have you been to a fiesta and tried your favorite delicacies like menudo, kare-kare, and lechon? Well, as you enjoy any of these, make sure you eat in moderation. What is a road trip without a food trip? It's not bad to enjoy eating, but take time to monitor your health, especially your cholesterol levels. The presence of high cholesterol in your blood can cause hypertension, which remains to be one of the leading causes of stroke and heart attack among Filipinos. Hypertension, when not properly addressed, may lead to serious complications. And as the summer heat continues to rise, beware about heat stroke and dehydration that target not just adults, but children as well. Hypertension and high cholesterol are both household names to many of us. But why is this so common? To discuss more about this, we have in the program Dr. Robin Flores. He's the head of the Minimally Invasive Cardiac Surgery Program at the Philippine Heart Center. Welcome to the program, Dr. Robin.
Hi, Freddie. I'm glad to be here.
Now, why is hypertension such a deadly disease?
Hypertension is often overlooked. People who are young, they say that it's a disease of the old people. But nowadays, hypertension can happen in younger people. And of course, we would want to resist the idea or the thought that we do have hypertension. Therefore, we hold off a checkup with our doctor. And sometimes it may be either too late or already in the advanced stage.
Why do we think is common in the Filipino lifestyle that makes Filipinos so prone to having hypertension?
Well, hypertension, there is a genetic component, but of course, the lifestyle plays a big role. The food that we eat plays a big role.
Definitely.
And those things, if you put them together, they can lead to hypertension.
Now, what are some of the symptoms naman, Doc, of someone who has hypertension?
Common thing would be headache. That's the most common thing to feel. More maybe serious symptoms would be maybe some chest pain, some shortness of breath, maybe rarely back pain, and sometimes weakness.
Now, what's a good, for those at home who have their own blood pressure monitoring devices, what is an acceptable blood pressure reading?
Right now, the recommendation would be a blood pressure not more than 120 systolic.
120, so this is the current value now for someone. So someone who has 120 systolic, are they considered hypertensive already?
Not yet. According to the latest guidelines by the American College of Cardiology, just last year, the hypertension would begin at 130 or and above. So what used to be 140 is now 130.
Okay, so it became lower pa.
Yes, that's right. So we would think that now more people would be considered hypertension based on that definition.
Okay. Now, what's the worst that could happen, doctor? That for someone who has hypertension, uncontrolled, thinks that, they feel okay, they just occasionally feel the headache. What's the worst thing that could happen?
Well, definitely one serious thing to happen is a heart attack. But stroke may also happen. But both of these two, they have very serious complications.
No, but since you mentioned heart attack, what's the latest now in the Philippines that's available for patients that suffer such a thing?
Right now, we do have available what we call a minimally invasive coronary artery bypass grafting. So from the usual cut in the middle over here, we can do bypass surgery from the side. But of course, these are just for a few patients. But if you do develop valve problems secondary to hypertension, we can do surgery from maybe either on the right side or somewhere here above, near the clavicle, near the collarbone.
Okay, so it's not the typical heart surgery or someone who has to undergo a bypass where, like what you said, they crack open the ribs and
Correct.
everything. So now it's just a small incision on the side. Wow,
Yes.
that's definitely...
So we can offer that now, and we hope we can treat more patients this way. It provides lesser trauma, it provides earlier return to work, and basically the patients are happier.
That's good to know. When we come back, let's talk about heat stroke and why it has become a serious threat, not just to people with hypertension, but also to many of us. And for moms out there, we'll list down some of the heat-related illnesses that are common to kids. Don't miss it. This is Med Talk, Health Talk. And we're back. Up to this day, there are a lot of misconceptions about heat stroke. Some think that by simply having an energy drink would keep heat stroke at bay. Some also relate it to a stroke, which is a blockage in the blood flow to the brain. To help us understand all of these, we still have in the program Dr. Robin Flores, and joining us is Dr. Nicole Pereiras, a pediatric infectious disease specialist from RITM. Welcome, Nicole.
Hi, Doc Freddie.
Now, let's go to heat stroke. Is this related to hypertension, Dr. Flores?
If you look at the way they describe heat stroke, it basically affects the cardiovascular system. So basically, heat stroke is a cardiovascular collapse. So that's how it affects the heart and the vessels. But hypertension may be related.
Now, going back to what a lot of people think, is having an energy drink enough to keep heat stroke at bay?
For me, heat stroke, just plain water would be the best.
Now, do you think this is the same thing for kids? Is it important to sort of give these energy drinks to kids a lot when they go out to play?
I think more than the energy drinks, when it comes to children, you have to plan ahead. So if you know you're going on an outing, now that it's summer, people are going to the beach, you have to be prepared, make sure you know what time the children can go out and play and how long they're exposed to heat.
What's the best time?
Well, avoid midday heat, which is roughly like 10 to 3.
Right.
So it's right on time for when children want to go out and play. It's midday.
Okay. Now, are kids more susceptible to heat stroke?
I think it's because children, when they're enjoying themselves, they don't notice, or maybe even the parents, sometimes they forget that, it's been too hot. And, these signs of heat stroke can come on suddenly. So like in children, you'd see like they're playing and then suddenly, they're a little dazed looking. Some can go into convulsions, so they're dehydrated quite quickly. So like as Dr. Flores said, it's really more of how the body reacts to this heat exposure.
So those are the symptoms when it comes to children. Is it the same with adults? Are these symptoms similar to adults?
Well, in adults, the most affected are the elderly, because maybe the way their body reacts to a slight elevation of the body temperature is different from somebody younger. So they're more susceptible, and usually they will faint.
Now let's talk about what to do where the children, you sort of see heat exhaustion and probably you don't want it to lead to heat stroke. What should they do?
So I guess before, when you're planning your child's activities, so you take note of how long they're going to be doing it, and then give proper sunscreen or sunblock, and make sure they're hydrated, because like while they're having fun, they don't really want to take a break and have a drink. So if you see signs of heat stroke in your child, you have to lower the temperature or initiate these cooling measures right away, and of course call for help.
Now, how about for adults? What's the best way to manage heat stroke?
Well, definitely it would be, if you do plan staying out, having a lot of water before you do that activity would be the best thing. Prevention is always better.
How about first aid naman, Dr. Robin? First aid when it comes to someone who experiences probably signs and symptoms of heat stroke or dehydration.
Well, first aid in a setting where you're maybe far from any medical help is actually quite difficult. Because one, if the patient is not responsive, that's a difficult thing, because you definitely cannot make him or her take anything by mouth, because that can cause many more problems. I guess one would be try to keep the patient cool Maybe put some wet towel around the body just to bring down the temperature and avoid the direct exposure from the sun. And at that point, I think it's important to, again, call for help and call the nearest emergency service to bring that person to the nearest hospital, because he or she will probably need an intravenous line.
Okay, now just for Dr. Nicole, this heat stroke, when it comes to kids, just so the parents are aware, is this a serious thing? Is this the same thing as just getting tired, or can the life actually of a child be in danger with heat
Yes,
stroke?
because this is actually a medical emergency if your patient goes into a heat stroke. So like Dr. Flores was mentioning, maybe prevention would be the best. So for kids, that would be wearing light clothing now that it's quite hot. And when that happens, when you're in an emergency situation for a child, you transfer them to a cooler area away from the sun.
Okay, great. Do you have any messages, Dr. Flores, for our viewers out there with regards to hypertension and being safe for the summer in general?
Stay away from the sun and try to plan your trips. Avoid being dry, so stay hydrated, and moderation, but do not forget to enjoy summer. It's one of the best times of the year.
And Dr. Nicole, how about for the parents out there? How can they have any message for them out there to keep their kids safe?
Well, now that it's summer, knowing that your kids want to have fun, even if you know there's a risk for heat stroke, just let them enjoy. But you have to plan ahead, of course. So that's in terms of like sun exposure and all that.
Okay, very, very well said, very well said. And with that, I'd like to thank Dr. Nicole Pereras for joining us and Dr. Robin Flores for sharing all your expertise when it comes to kids and adults for this summer. And when we return, if you feel tired from all your trips this summer, get to know the health benefits of massage using liniment oil and discover how the magic of touch can help achieve a long-lasting relationship. Keep it here on Med Talk, Health Talk on CNN Philippines. Aside from being a couple, James and Rosette work in the same company. James works as a technical support specialist, while Rosette works on the administrative side of the company.
I'll be available for around 2 p.m.
With the kind of setup that they have, they share not only their love for each other, but also the stress they get while working.
Ang madalas sumasakit sa akin, siguro likod, kasi more on buhat kami. Mabigat kasi yung mga ginagamit naming unit, lalo na yung mga power supply.
Oh, from time to time naman chinecheck ko siya lagi. Tinatanong ko, may masakit ba sa'yo? Usually, lagi talaga back pain talaga.
That's why at home, the only relief to an exhausting and physically challenging day of the couple is a simple massage. Especially for James, who often complains about his back pain. Massage is a popular choice among Filipinos that eases body pain and stress. And for couples, massage is not just a remedy that eases body pain, but a language that strengthens love and good relationship. Here we have Ma'am Venus, who is a certified and licensed massage therapist, as well as James and Rosette, who have been married for the last year but who have been together for the good part of 10 years. Correct? Ngayon, James and Rosette, pareho kayong may career, ano? Sa tingin nyo sa trabaho nyo napaka-stressful, malaking tulong ang pagmamasahe every now and then.
Sa akin, Doc, opo, napakalaking tulong niya. Gawa ng, hindi mo may sumakit sa'yo, like yung ininda ko yung back pain ko, then my shoulder. So, pagdating sa bahay, si Mrs., simpleng massage lang, hinihingi ko sa kanya.
Sa akin naman, stress talaga. So, ang madalas po sumasakit sa akin yung batok ko talaga. Kasi pag sumakit na po yung batok ko, sasakit na din po yung ulo ko.
Ma'am Venus, anong mga benepisyo ng pagbibigay ng magandang masahe?
Ang benefits po ng magandang masahe, Doc, release ng stress, then tulong para sa mga taong mga pagod para makakatulog sila kasi minsan ang pagod, isa sa dahilan na hindi tayo nakakatulog.
Anong mga benepisyo ng liniment oil kumpara sa mga creams or ibang klaseng mga oil?
Efficacent oil is the most effective liniment na gagamitin para sa isang massage kasi paghaplos mo pa lang, nararamdaman mo na yung hagod niya na masarap. Then, yung menthol niya, absorb ka agad sa katawan ng tao. At the same time, pag once na ihagod mo na siya, nararamdaman ng katawan natin na nag-absorb siya sa ilalim. So, ngayon, ipaparamdam natin kay Sir James yung hagod may efficacent oil.
With the right formulation of liniment oils, one can enjoy the health benefits of a body massage that helps in blood circulation and releases stress in the muscles. Ngayon, Ma'am Venus, anong mga pangkaraniwan na bahagi ng katawan ang una niyong minamasahe?
Ito pong part na to, kasi ito po yung, nandito po nakaatang sa balikat ang lahat ng bigat. So, ito po yung unang-unang tatamaan natin. Then, follow dito sa scapula niya or palikpik niya. Etong part na to na may mga muscles na to, kasi ito yung madalas na may nararamdamang sakit hanggang pagdating po yan dito sa may balakang. So, need na lalagyan po natin siya ng oil or efficacent oil para yung hagod hanggang ilalim.
Sige,
Ito
tignan
po.
natin.
Mas effective po siya kasi ramdam niya kaagad. Pag haplos mo pa lang sa kanya, ramdam na niya yung anghang or menthol.
Okay.
Okay. Hanggang sa dulo.
Okay.
So, ito na po yung dapat na unahin natin. Ihahagod natin na doon sa nararamdaman niyang masakit sa shoulder.
Okay.
Then, eto, sa scapula, dito po natin ipapatama sa kanya para ramdam niya rin yung panunuot doon sa palikpik kasi nandito po nakasiksik yung mga lamig-lamig na nakukuha niya rin sa pawis dahil sa pagod, sa trabaho.
James, may nararamdaman ka bang effectiveness ng liniment oil katulad ng init o yung heat?
Okay. Nararamdaman ko yung parang pumapasok siya sa skin ko.
Since nasa may area ka ng leeg ni James, Ma'am Venus, dapat maalam din ng mga tao na safety first, ano? So dapat hindi masyado madiin sa mga areas na ganyan.
Yes, Doc. Kasi nandito po itong mga nerve na dapat hindi natin magalaw ng madiin or hard. Hindi natin mamamalayan na meron na pala tayo napigtas or naputol. Okay. So, light massage ang kailangan gamitin. Hindi po kailangan idiin, lalo sa mga matataas ang dugo.
Okay.
Gaano kadalas po kaya pwede gawin yung katulad niya, yung pagmamassage using the efficacent oil po?
Pwede nyo pong every time na gusto nyo pong gusto magpamassage ni sir, pwede nyo pong gamitin ang efficacent oil. Wala pong limit doon. Dito po, ikaw mag-start. Ma'am?
Dito po muna?
Yes, ma'am. Then, yan po yung mga common areas.
Kailangan bang maligo pagkatapos ng masahe?
No. After 8 hours, doon pa lang po siya pwedeng maligo. Then, yung pampaligo niya is kailangan maligamgam na tubig. Not allowed yung malamig na tubig na galing sa faucet kasi maaari din siyang magti-trigger ng matinding sakit sa likod niya.
Okay, so dapat warm bath after 8 hours.
Yes, Doc.
James, kamusta ang pakiramdam?
Refreshing. Sobrang ang laki ng changes niya. Kasi pakiramdam ko na parang yung likod ko, kung ano yung nilagyan, parang yun yung part na malakas sa akin.
Na ngayon, James, Rosette, sa tingin nyo, paano nakakatulong ang massage sa relationship ninyo?
Ang work kasi namin is Monday to Saturday. So, we have limited time lang sa pagbabanding namin. So, etong massage na to, parang ito na yung pagiging time namin para mag-banding.
How about you, Rosette?
Ako naman, syempre kami tumatanda din eh. Lahat naman tayo tatanda. Ngayon, ito na yung start. At alam ko hanggang sa pagtanda namin, magagamit namin ng efficacent oil.
And there you have it, how a simple massage can be made more meaningful and effective with the use of liniment oil. And join us again next week for more interesting topics only here on Med Talk Health Talk on CNN Philippines.